just going to keep shifting, that's all.
It's recording now.
Oh, you see it?
Yeah.
Didn't show up on mine. That's weird. Okay. So we're going to call to order at 6:37, and I'm going to share my screen. Can you see the flag?
Not yet.
Not yet.
It didn't seem right. Let's save.
There we go.
All
Yep.
right. If we could all just rise and say the Pledge of Allegiance. Oh, God. Pledge allegiance
To the flag
Of the
of the United States of America,
and to the
And to
to the
republic
republic
for
which it stands,
one
One
nation,
a nation,
under
under
God,
under God,
indivisible,
indivisible,
with liberty and justice
Justice
for
for
all.
all.
Okay. All right, let me stop that share. All right, we're back. And did everyone get the minutes from the last meeting and the meeting prior? The last meeting we called to order and then adjourned for lack of a quorum. And then we just need to review and approve the minutes from previous. Does anyone have any questions about the minutes or?
no.
no,
Okay. Does anyone want to make a motion to approve both?
sure, I will.
Is it
Second.
April and May and June? Sorry. Okay, so Jean and Kathy, perfect. So the next on the agenda is just simply just a quick discussion of where we are as far as COVID-19.
Want to do roll call?
Oh, that would be helpful. Thank you, Jean.
Sure. Okay, so Catherine Tucker,
Here.
Heather Shea,
Here.
Dr. Amir Mohammed.
Here.
Absent is Maureen and Kebby.
Perfect.
Okay.
Sorry about that. Skipped right over that.
I printed out the agenda for the first time and it's actually very helpful.
It really is for taking notes. Anything
Yeah.
I do, the agenda is always my notes when I'm secretary and taking minutes. Okay, so COVID-19 and sort of where we are. I know they did. I'm gonna, Dr. Muhammad, if you have anything to add, but the one thing I can add is I know they did one, not sure, and possibly it was the last, I believe, scheduled clinic for the last few people last Friday.
Yeah, I believe so.
Yeah.
Yeah. I don't know when was the exact date, but I think that now we're pretty much everywhere tapering it down because the state, again, the vaccine supply is pretty widely available through many pharmacy stores and others.
Yep.
So no need to, waste all the resources. But we will see what happens in the fall if there is a need for booster and what have you. we'll see from what the state guidance are. I think right now what we are discussing internally is how the schools would look like come fall.
Has there been a discussion since the CDC put their statement out about masks in the school and what that?
Yeah, so the state sent a little blurb, the CSD, Connecticut State Department of Education, sent a little blurb saying that they're looking at the CDC guidelines. They will provide further instructions as the time nears. They're still going to look at, CDC's guidelines are for throughout the US, right? Connecticut is in a different position as compared to other states when you look at the rate of infection. But the bottom line is the school should remain open. And I think it would be helpful for us locally to make a final determination as to what to do than to have a sort of a one decision blanket making throughout the state, right? So the situation in New Haven is different than West. I mean, at least West Haven is 50% or above. What New Haven, Bridgeport, and other bigger cities have lower vaccination rate. So, it should be up under the purview of local health department to decide what sort of a best model should be. So we'll see.
Yeah, I think that that's going to be a question that a lot of parents, as we get into end of July, going into August,
Yeah.
what do we expect is going to be starting to be asked. I mean, it's already being asked, but as we get closer, it's going to be asked more. I know even I had that question once they released saying that it might not be necessary or won't be necessary.
Dr.
I-
Mohammed, sorry.
It would be a blanket statement. And I just, in some cases, it's nice to have across the board rules. And I agree. I think that we need to look at what works best for our city in this situation.
And that's how we had been working, locally. We were not just looking at, okay, well, that's what's happening in Hartford or Waterbury, therefore we should know. We have to look, that's the whole thing, it's so much differences. There are some similarities, but there are some differences also. So we just need to be cognizant and make our recommendations based on the local data. So it should be a data-driven approach, So yeah, let's see.
Jean, you had a question?
I just wonder Dr. Mohammed's thoughts on, kids who are not vaccinated being mandated to wear masks. And do you think that that's the route that they're going to go? But then kids under 12, that means they would have to wear it all the time.
Yeah, so if you ask my opinion, and I've been contemplating and looking at the studies and what have you, the 12 under will not have any vaccine anytime soon. We know that, right? So let's see what happens after these pharmaceutical companies submit their EUA application to the CDC. I honestly think, looking at the data, that the rate of infection is very, very low among kids, younger kids, which is a good. We need to look at our data. If our community is well above 50% or, reaching towards a threshold, and we can follow some of the mitigating strategies, right? Why not look at the mask policy a little bit more carefully? As I said, I mean, I don't see that we should just blanketly say, again, this is completely my opinion. We will know what the DPH and CSD jointly come up with their recommendations, but I really want to push, or at least would like to see some wiggle room for us as a local health department to make policy based on our data. So yes, for now, 12 and under are recommended to wear the mask regardless of what the rate of infection is. But if they belong to a family that are fully vaccinated, I think one can look at the public health approach through different lenses, and that needs to be determined, when the time comes. Now, bearing in mind, we do think that the Delta variant is circulating as the most predominant strain now. I mean, you just wonder, right? One starts in Asia and comes right here in a matter of weeks. One starts in Europe, and so it just, they have there's no geographical borders. These are all porous, right? As we see in the medical world. So yeah, the global effort should emphasize, how quickly we can get the vaccine to these areas and curb the transmission and infectivity in those countries. So it needs to be a global effort. I mean, that's what the public health experts are saying. You cannot just ignore, somehow close these virtual gates and boundaries. And it needs a really. The good thing is that the current vaccinations do protect against the Delta variant, which is very assuring. So therefore, I think if the communities and the parents and families have done their part, got themselves vaccinated, I think their children are more protected, quite frankly. I mean, they're not as vulnerable, despite the fact that they haven't had their own vaccines, right? 12 and under. But because of their elders who have. Now, if you go back in time, we saw that many kids developed infection after being exposed to their own elders, whether it's a grandparent or parents or siblings, right? It was not the other way around, that the kids were getting sick or infected from the school environment, right? So we have a somewhat idea of how the transmission has been. The kids do not spread infection, younger kids do not spread infection as vigorously as adults do. So we have to blame the adults. So if those family members who have been fully vaccinated, I think they should be rest assured that there's a very little chance or low risk for their younger family members to be infected. So that's the hope. I mean, I'm betting on that folks who are still hesitant, or still maybe that will push them near the fall to get vaccinated. And all the major colleges and universities have mandated it, right? So there's no question about it. So healthcare workers or Connecticut hospital associations are going towards that as well. All the healthcare workers are going to be mandated to receive the COVID vaccine. So,
Yeah, Yale just presented that it's going to be mandated now.
yeah, I wonder
All the
what Dr.
hospitals
Mark
in
Lucy will
Connecticut,
think about it.
Our numbers in West Haven specifically are remaining fairly stable, and we are pretty well up there still with our numbers of fully vaccinated, or at least one dose, because we got pretty high up there in a fairly good amount of time, and we're still staying pretty stable as far as infections and everything.
Yeah, so the state is 61% one dose and 68% fully two dose, right?
Mhm.
So that's the state.
Mhm.
So 61% two doses and 68% one doses. And West Haven, we are 57% with one dose who have initiated, and 52% with two doses as of last week.
Good. Hopefully we'll get up to the 70s. That would be lovely.
Yeah, I mean,
Did you say West Haven was 51% two doses?
yes. Let me just refresh. Hold on.
Is Griffin still also doing some area clinics in the city? I know they were doing something, planning something on the green, or
So my understanding is that Griffin vans are partnering with DPH. So they are offering those mobile clinics. So if there's a pocket of community where or businesses, they can coordinate to us to the health department, or they can contact DPH directly to offer those pop-up clinics, right? These are vans that are, again, this is like a Griffin staff who run the show, and DPH primarily oversee all the operations.
I have to say, and Kathy, maybe you can speak to this, the day that we were at the Juneteenth celebration, I was kind of torn about my feelings about not having a lot of people, because obviously I was disappointed that we only got a couple people vaccinated, but I felt more encouraged that the reasoning we were getting was, oh no, I've already had mine. Like, I didn't speak to anyone who was saying like, no, absolutely not. I'm not comfortable. I don't know about you, Kathy, but that was where I was.
I agree. I mean, that was my experience, because I was walking through the crowd and really trying to encourage people to go ahead and get the vaccine. Everyone that I spoke to had already had the vaccine. There was one gentleman who said, he's scheduled to do it at another time, and he had already had a plan in place, and so he wasn't interested in doing it out there. But I agree. I didn't get the whole hesitancy conversation at all, honestly. Pretty much everybody, had already been vaccinated. So that's how come I felt, it wasn't all in vain.
Yeah,
We were out there.
100%. That's exactly how I felt. I was, obviously I was hoping we'd be, get a lot of people waiting at the table, but then young and old, didn't matter which age we were talking about. Everyone was like, oh no, I've already had mine, you know, and mostly positive even about it, you know.
Oh yeah, that was
Bad.
my experience as well.
So, anything else in old business as far as COVID that we want to cover before we move on to new business? All right. So I'm going to move on to new business. And so the next thing that I'd like to speak about, and I'm going to let Kathy present, is maybe where we go from now as far as future planning around diversity, equity, inclusion, belonging, you know, anti-racism, cultural competency, social determinants of health, and what our work is now going forward, because as we're coming out of COVID, I think as a board, we have now the ability to work on some new areas. And Kathy, I have to thank you. When you said DEIB, I had to ask you because I had always used DEI. I'm like, wait a minute. So thank you for educating me on that.
No problem.
So
What does B mean? Sorry.
Belonging.
Oh, okay.
Belonging, right?
Got it.
See, we all got to learn together, right? That's what this is all about.
So I'm going to turn it over to you, Kathy.
Okay, I'm going to share my screen, okay?
Yep. There you go. Yep.
Okay. Yeah, so that is again the topic, DEIB and anti-racism. And so my whole, can you see it? Okay. All right.
Mhm.
Yeah, so I just wanted to kind of start off with just beginning the conversation, you know, for us together as, you know, a board of health, but then for anyone who's watching, because this isn't just ours to do alone, right? And so part of what I realize is that the language that we use sometimes doesn't make sense to everybody. And I think it's really helpful to start the conversation with just level setting about what are we even talking about here right now. And a lot of times people don't see the links between health equity, diversity, equity, and inclusion, anti-racism, you know, racism and healthcare and or the lack thereof. So people don't really understand how it all fits together. And I think we have an opportunity, a real opportunity to kind of just like really just begin to have the conversations, because I think that's where it all starts, is really just having a dialogue. So wanted to just start out with just the two definitions, because we use these terms interchangeably, health disparities and healthcare disparities, and they're different. Health disparities refers to a high burden of illness, injury, disability, or mortality experienced by one group relative to another. And healthcare disparities is really talking about like the systems, and typically refers to the differences between groups in health insurance coverage, access to care, use of care, and quality of care. And that's from the Kaiser Family Foundation. You hear a lot maybe mentioned about social and structural determinants of health. And these are the things that impact where we live, work, play, and worship. And a lot of times you hear people talking about your ability to be healthy is really dependent upon the zip code where you live, right? So it's where you have access to things that keep you healthy. A lot of what we do in the hospital anyway is impacted by whether or not people were able to stay healthy in their community and in their environments and where they work and that kind of thing. So there's a lot of attention now being paid to the impact of the social and structural determinants of health, such as housing, health and healthcare and access to healthcare, food security, whether or not you have food available to you. Do you live in a food desert? Are you on a bus line where you can get to a grocery store? Do you have access to vegetables, fruits and vegetables, or is the closest thing to you, because you don't have a car, the corner store that only sells canned goods that are full of salt and you have heart failure, you know, things like that. Your employment status, finances, your education, and of course, racism. If you live in an environment where racism is prominent, more so than in other places, that's not good for the health of the community, especially poor and minority communities. So we in West Haven declared racism as a public health crisis, right? So there's a community alliance And a lot of this conversation, I think, could shift at some point to how we're going to, connect together with the Community Alliance, the City Council, who approved the document that was put forward, declaring racism a public health crisis in the city of West Haven, along with several other cities in this in the state of Connecticut. But across the country, 200 plus local and state leaders and public health departments declared racism a public health crisis. And what this does is it encourages advocacy and education, which could lead to strategic actions and plans for people to come together to really have an impact and address the challenges, improve racial equity, address social justice issues, and eliminate factors that lead to the disparities that we just talked about. And just trying to move this thing out of my way. And the declaration of racism as a public health crisis also brings into focus the systems that are contributing to these racial disparities, like the social determinants of health. I mean, where we live, if you just look at the city of West Haven alone, you can, I think we all know that Allentown, majority, minority communities, right? Other places in West Haven, not so. Well, why is that? And what is that about? And how does that impact the health of our community overall and the city overall? The resources and how we distribute the resources and how we kind of interface with the resources that we do have. And so it also encourages cross-sector collaboration with stakeholders in positions of leadership and power that can make changes to things like housing, access to healthcare, employment, education, and other things, right? So it's a good conversation to begin to have. And I think that we would benefit by working together in this cross-sector collaboration with the Community Alliance and other groups, not just the City Council, but other groups in West Haven that really have the ability to make an impact. So I wanted to take a minute to explain equity, because I believe it or not, a lot of people still don't understand what you mean when you talk about equity. And I have two infographics that I want to share. And you may have seen this. This is from the Robert Wood Johnson Foundation. Have you guys seen this before with the bicycles? Have you seen it already or no? Okay, so health equity, it's basically saying that equality means that everybody should just have access to the same stuff the same way. But health equity really makes it so that people who have special requirements get the needs met that they have, so that when they get the resources that they're after, it serves them better. And so you see the person in the wheelchair on your top left here, she can't even ride the bicycle, right? So if everything was equal and she has a bicycle, you would think that she'd be able to just, have the same access, but she can't. Her experience would not be the same as everyone else's. The gentleman whose knees are up above the handlebars, and the person in the third position obviously looks the most comfortable anyway. And the little person on the right is really struggling to reach the pedals. But in an equitable environment, accommodations would be made so that their experiences fit their needs, and then therefore they're able to have the same experience. And that's kind of what we're talking about when we're talking about equity. It's leveling the playing field. But there's another infographic that I like a whole lot better. And I really want to take a minute to kind of just like talk this one through. There's the one on the top left that talks about inequality. And if you look at this tree, it's kind of bent towards the person with the fruit falling from the tree, right? There's an abundance of fruit on that one side of the tree, not so much on the other side of the tree. These people are probably about the same height. There's fruit falling from the tree from the abundant side. That person doesn't really have to do anything. That fruit is falling right into their hands. But in an equal environment, you would think you just give them both a ladder. The ladder is the same height. They should be able to go after these resources and just experience things the same way, right? Not so much. You see that with these accommodations, the person on the left now can reach the tree and get the fruit from the tree on their own, without any help, without any additional assistance other than the latter. The person on the right is really still struggling and really can't even access the same. And still the abundance of fruit is on the other side, bent towards the other person on the left. So equity. So you give the bigger ladder to the person who doesn't have the ability to touch the tree with the ladder of equal size. Okay, so now you've made some accommodations, and this person really should be able to get at the fruit now, right? But there's still a lack of abundance of fruit on that side, even with the additional support of a taller ladder. But the person on the left is still just kind of not really having to work very hard at all to just enjoy the fruit of that tree. But when you apply justice to the equation and you straighten the tree out so it's equal and there's an equal amount of fruit on both sides of the tree, they have the same ladder, the same size, and now they have the ability to access the tree and the fruit of the tree equally. And so the point here is that sometimes all things being equal still don't lead to equity. And even with equity in some instances, you really need justice to really, really change the dynamic for the people that are impacted. And so I hope that that kind of really illuminates for you the problems that we might be, faced with as we think about the work that's ahead of us going forward, and really just try to remember this and frame things from the perspective of equity, equality, and justice, because they really do mean very different things. So of course, we all know, we talk about COVID. You guys have been talking about COVID every day. I mean, every meeting that you've had so far, and or we've had so far, and have been steeped in it in your work environments and in everyday life. But this pandemic was really two pandemics. It was a pandemic of racism as well as COVID-19. And what it did was it illuminated the impact of racism and structural racism that COVID-19 had, especially on people of color who were disproportionately impacted by COVID-19. It kind of revealed the lack of safety net for people of color. And it exposed years of structural racism and the impact that it's had in the wake of the pandemic. And these social structures, were highlighted, and the structural racism were highlighted. We saw the murders of unarmed Black people and the impact that had, and then all of the, protests that broke out, and people kind of really saying, hey, this is not saying that things are not equal for us here. They're just not. We're not having the same experiences here. There's two sets of rules here, and we're suffering as a result of it as people of color. So there was that. And then, of course, many people of color were essential workers and had to be out and about and dealing with the public, and were therefore more exposed during the pandemic, and then more likely to bring COVID-19 home to family members. And if they were people of color, obviously that you know how that could have played out. So this is just like a high level, statement of how COVID-19 impacted people of color and how racism kind of played into that, and the way that we saw it play out in 2020, but it continues to kind of carry forward, and we still see the impacts of it even now. And so those are some of the things we also have to think about, because we're in the middle of this, right? We're not done with it yet. We know that we're only 50%. We just got finished talking about it. We're only 50% or so vaccinated, and then we have these other variants that are still out there, and their impact on people who are unvaccinated, we will see. And so we are not through with this yet. Then there's the environmental justice, and our guy Van Jones made a statement that I have here, that environmental justice is the movement to ensure that no community suffers disproportionate environmental burdens or goes without enjoying fair environmental benefits. And so we think about that, the impacts of air pollution, we know, have horrible effects on asthma and, other disease states, toxic waste, and landfills, contaminated drinking water, lead paint. We had a huge problem with lead paint, especially in like the New Haven community. I think Hillary Clinton, when she was here at Yale, she did a lot of work with the Black Nurses Association, Southern Connecticut Black Nurses Association, and led the effort to change the laws that pertained to lead paint. And whether or not you even live in a floodplain, we just, we're kind of dealing with some of that now, where people's homes are flooded with all the rain, sewers. We have problems with sewer systems here in the community that still have to be addressed and things of that nature. So we have some work to do, but we also need to pay attention to the environmental issues that may plague the communities that we are responsible for supporting. And then, of course, I want to talk about like racial trauma, because we know that right now, post-COVID, everybody is suffering from, the fallout in the wake of having gone through that pandemic in some way, shape, form, or fashion. And I think we can all say that we need to pay attention to our friends, family, and especially our healthcare workers and the impact that COVID has had. But I also want to highlight racial trauma. And it's a little bit different. Racial trauma is a form of race-based stress that refers to people of color and indigenous people, and the reactions to dangerous events or real or perceived threats or experiences of racial discrimination. And such experiences may include threats of harm, injury, humiliating or shaming events, and witnessing racial discrimination towards other people of color. And this is a little bit different. In this, like people talk about PTSD, post-traumatic stress disorder is often referring to situations that have happened already. They had an end, it happened in the past. Racial trauma is ongoing. It doesn't stop. It just continues to kind of happen over and over and over and over again. And so those things are real for many people of color and indigenous people in the United States. So when we talk about vaccine hesitancy or vaccine avoidance, there may or may not be a relationship to trust of the medical community. Sometimes it's just, it's related to this, and sometimes it may or may not be. But I think it's helpful for us as health professionals to understand that there is a lack of trust by many groups, and not only people of color, of the medical establishment. But when we're speaking about people of color, there have been multiple atrocities over many, many years, and some in the not so distant past that deter people of color from trusting the medical establishment. And we've got work to do in helping to make sure that anything that is going on is safe, and that we are really doing our due diligence and making sure that we help people understand the importance, especially when we're talking about this vaccine right now, the importance of vaccination, the safety of the vaccine, and all of the details that go along with that, because these are the things that many people of color in our communities are aware of. And that's why I think it's important to understand and know where this fear comes from. So we talk about James Marion Sims, the father of gynecology, who committed atrocities to enslaved Black women. These stories are, out there, and he did this without, anesthesia. Henrietta Lack, she died of cervical cancer. Her blood cells are the HeLa cells. They're immortal cells that are still being used today around the globe. And her family didn't have any information about it. They were obtained without this woman's consent. Family received no compensation or profit, and no one was held responsible or accountable for this. Fannie Lou Hamer, she went in to have a uterine tumor removed, and instead was given a hysterectomy. Many other Black women have had similar experiences, because at one point in time, there was an effort to prevent Black women from having children. I'm sure many people know about the Tuskegee syphilis study, which studied the treatment of syphilis in untreated males, where the subjects were purposely given syphilis and also purposely not treated despite there being treatment discovered. So these are not, this wasn't terribly long ago for some of these instances that occurred. So these are real things, and there are many, many, many more. But these are the ones that people know most about that I just wanted to kind of bring forward here. And I want to say words matter, because we have to call these things what they are. We have to call systemic racism. We have to call racism. We have to call things out. It's when you kind of try not to use those words because we're afraid someone may be offended by the use of the word or the history that's there. It may offend people. Well, that's not going to help us get past the fact that the history did take place, and these things do impact us in very real ways every day. So it matters, and we need to call these things what they are to make the difference that we need to make. So if change isn't being made to improve the contributing factors to racism, such as systems, structures, policies, practices, procedures, norms, at the individual, meso, and macro levels, then they're going to be perpetuated. And that is exactly what we do not want to do. So we've got to know and understand the challenges that are before us and why they exist and why we may experience people the way that we do, to understand where they're coming from. So I'm going to stop there. I'd like to answer questions if anybody has any questions, but I would like to propose that we connect together with the Community Alliance and figure out ways in which we could bring to life their vision for the work that they put out there before the City Council, which was approved, naming racism a public health crisis in the city of West Haven. And in addition to that, the NACCHO, I sometimes forget what it stands for, but it's the group of professionals that from public health organizations comes together. They have a wonderful course called The Roots of Health Inequity that I think would be a wonderful course for us to take, and any people in the community that would like to join in and take it, that would help educate folks on the sources of these problems, that we in ways in which we could mitigate or eliminate any of the problems that are before us that come up. So I just want to stop there and hear from you guys. Any feedback, questions, thoughts?
Great presentation.
Thank you.
I just want to thank you, Kathy, because I know, personally, this is important to me that we continue to move forward with what the groups have already started. But, now we help to move it along. And I think that we needed to start this conversation and say, where do we go from here now? What can we do to help? And yeah, connecting with the Community Alliance, and anyone else who's doing work on this within our city, I think is definitely, you're right, the next step.
Right. And there are opportunities also to connect in with other, departments, the hospital, as well. I know that there are many opportunities there, and I'm actually working on something that I'd love to share with you guys at some point, where we would love to work together with the city of West Haven and, kind of address some of the challenges that we know we face as a community here in West Haven. Hypertension, heart failure, things of that nature. Yep. So we have a real opportunity to kind of make a difference, and we would love to partner together in that way. And there are others, that I'm sure would be willing to jump in and be involved as well.
Jean, do you have anything or that you wanted to add, to ask? Not to call you out, I just don't want to
don't put me on the spot or anything.
I know, I just don't want to move beyond you, and I didn't know.
It's okay. Not off the top of my head. I think it's a great thing to get involved with, and I'm sure there's lots of people that would like to collaborate as well. So I think it's exciting to help create and help move things forward, and to be part of it.
Mm-hmm.
Yeah, I think just starting the conversation is a good. I mean, we're at the point now. Like, I think we have to move beyond education, because we've been talking about education for a long, long time. And education is definitely needed. It's necessary, but if you're, you got to do some of that on your own, and take the time to kind of really educate yourself on the things that you don't know and aren't comfortable with. But I think really getting at the sources of these challenges is really, really important right now. And to know where to go and how to help, I think is really important.
And
Also,
actually,
too, explaining like, because some people just hear like, oh, well, how is racism a public health crisis? A lot of
Right.
people don't grasp what that really means. And, I have to be honest too, that like I had to really delve into what that really meant and how it does present as a crisis. So
Yeah.
I think a lot of people are sort of on the same, needing the explanation or the conversation as to what it exactly is.
Yeah. So, I mean, I think, again, a lot of it is you have to do the work of kind of understanding that. But I think also you have to bring information to people for them to know where to go and what to look for and to, what to delve into. And so I think we can have these conversations in an ongoing way as this evolves. And I think that would be helpful. I think it would be helpful, but I don't know, what other people might think. But you have to start somewhere.
well, I agree, wholeheartedly with you. I think as a board, if we're willing as a group to pick up the, I want to say gauntlet, but, and just move with it now, I would be 100% supportive of that. And the reason why I was asking Eugene is because I didn't want to move beyond this topic, but I think the other part that I have in new business kind of is intertwined with this. And this is why I wanted to talk about the bylaws, because we're an advisory group. And, I think we need a little more help defining where to go, what we can do, and work we can do, and guidelines. Because I want to be sure that we're saying, talking to the right people, not saying to the right people, talking to the right people, and what is our ability to do. Like, I'm just not clear. We have the charter, we have, we're advisory. That's what we're told. We can have these conversations, but how far can we act? Because I feel like we need to put some actions into place in order to help in this situation. I don't know if I'm making sense with what I'm saying, but I don't want to overstep our ability without.
So I guess, what bylaws exist currently?
There aren't any. That's what I'm saying. We're supported by the charter.
Right. So then I think you follow what the charter says and then go from there. I mean, creating bylaws might be creating limits on,
Well, that's true. That is a way to look at it. Yeah.
Right. And so if you're advisory, then the job is clear, is that you advise. And especially in the context of this conversation, because I mean, we could have had this in the context of any other conversation before, and I don't want to frame it bylaws being created around this discussion. That's for sure.
No. But I'm just saying in general, no, absolutely not. But I'm just saying in general, when we're putting things into action, can we, in general, make recommendations that will eventually become, I don't want to say law. My words are not coming out freely. That will eventually become like referendum, or, that we can introduce to the city council ourselves. Can we do that? And that's where I want to make sure that we have the ability to do that. And that's.
So the city charter has a section for the Board of Health, right? So,
but it really doesn't give much direction. That's the problem.
Right.
So I just want to be sure this group that we have, I think, has the potential to make a big difference.
Right.
And that's what I want to be sure that we continue to move forward and do that. That's kind of where I'm going with this.
Right.
So I just wanted to have that discussion and just mention that where my concern is when I review the charter, and I had it ready to be pulled up. It's very, broad.
I
So
guess I don't understand like what you're worried about. Like, you know what I mean? When you're saying you don't want us to kind of, what would be your concern? Because if you're making a recommendation, it's because the group kind of felt that there was a need for something to be done. Like,
okay, right. And so are we comfortable then? That's fine with only having, we wouldn't then present to city council, or we would simply present to the Board of Health, and it would be, to the health department, and it would be up to Maureen and her.
Well, who are we responsible to? Because we were appointed by the city council.
We are advisors to Maureen and the health department.
I don't know. I would have to get clarity on that because I'm not clear about.
Mm-hmm.
Dr. Muhammad, I'm not sure because if you might know the chain of command here.
Pull up.
Yeah, my understanding is every department is sort of different. I think in West Haven, Maureen reports to the HR chief, right? So that's they don't, and some health department, they are appointed by even the health director, and they are hired or appointed or promoted by the Board of Health. So I think in West Haven and Orange, they are more advisory. But you all are, I think when you got the appointment letter, did the mayor sign on your selections? Yeah. So you are right. You are officials in a sense, but your role is more of a steering the health department in the direction where we as a group, not you, we as a group would like the health department to focus on. So primarily based on so for example, if we choose a topic, DEI, and say then we can provide guidance to and instruct the health department to say, look, we want you to focus on that. And then another conversation would begin to look at the resources and tools to accomplish that goal. So the way to see is like the Board of Health kind of sets the direction, sets the goal, yearly goals and all that, and you all are fully capable of sort of advising what we need to focus on. And then the health department would kind of go through their own internal processes and present the budget or present some of the other objectives to the larger leadership. And that's how I think again, this is my understanding.
Yeah, and I think it's got to just be collaborative because I just don't want to think of it as there's one that's responsible for the other. I think that this is supposed to be collaborative, right?
Yeah, advisory, collaborative, guidance.
Yeah.
It says the powers are, we can recommend for adoption by this. I pulled it up so I can look at the exact wording. We just simply recommend for adoption by the city council health issues.
Yeah.
Issues potentially affect the health of our city. And I just want to make sure, because I think we need to collaborate. And I just want to make sure that that's not in any way, going out of our purview of what we can do. And I don't think it's not in the charter saying we can't. So I think you're right. I think by taking it that way, if we were to talk about bylaws or, that sort of thing, it might limit our ability to research and collaborate with others and in this issue and with it. But as we were having the conversation, I was just kind of going to that because that was the other thing I had in the new business. I want to make sure we have guidance on what we can do, because I think that we're the first Board of Health for quite some time that has been active. So, and I think that that we have a lot of work
In the middle of a pandemic.
in the middle of a pandemic. So that was why I added this to the board. So I think, to the agenda for the board to discuss. And I didn't want to move to that without sort of saying, this is making me think even more about it, because I want to collaborate with other groups. And as long as we as a board are okay to do that, I think that's where we need to go. And I don't know what anyone else thinks, but I just wanted to make sure we had the conversation of, we do only have one very small paragraph. How does anyone feel about where, what we should do about that, and make sure our work is guided and we're doing it appropriately for our city. And if no one else has any feelings about that, I'm fine with it.
I say leave it. I
Okay.
wouldn't, personally, I wouldn't
Look for
add any
yeah.
language to that. I think it's clear. And I just think that the way that things happen, and who would have ever dreamed 2 years ago that we would have had a pandemic that literally shut the world down
Mhm.
and would have changed literally everyone's life. Like, who would have known that? So I think you can't really predict. I don't think you really can tell what's going to happen. And I think, just leaving it open.
I don't know enough about bylaws really to make an opinion one way or the other, to be truthful. Whether or not that would hinder or help. It seems like having more strict guidelines might hinder a little bit, but that's just from not knowing much about all of that.
Well, I served as the chair of the bylaws committee for the National Black Nurses Association. So I would have to tell you that, in my opinion, I think it would be, what would be the point? It's, it would give you a set of rules, basically, that you'd all have to follow. We'd all have to follow. So what are bylaws except rules?
Yeah.
Right? So.
And the reason why I wanted to bring it up is because it's what I'm used to functioning with, our policies, rules, structure. And I just wanted to make sure we all knew that we are guided by our charter, but we do not have bylaws, and should we speak about it. And you put it in perspective that I like structure, and but you're right. I think that it could pigeonhole us and limit us on what we are able to accomplish.
Right, and then where would the responsibility then fall? But on the health department to figure it out alone, because we would have written ourselves out of the script.
Yeah, you're
when
right.
The city council asked us to be advisors and recommend solutions.
You're 100% right.
To them. So why?
And just because we recommend doesn't mean they have to listen to us.
Absolutely right. Absolutely right.
Okay. I just wanted to make sure we had that discussion clearly as we're growing and finally coming out of COVID and only having a,
right.
So. And I think Dr. Muhammad, you kind of made your point clear before. So I agree. I think we had the discussion and we'll just move on with that. But for the other new business, and I know I'm circling back, where are we going to go from here? Because I think, Kathy, I can't thank you enough for that, because that one infographic alone, I think, was an eye opener, honestly, for me, because it puts it in a different light. It makes you really understand what you're looking at.
Yeah.
And I had never even seen the bicycle one, which was great, but the tree, that was, yeah.
Yeah, I think and again, this is the work. If we're all nurses, right? And if we don't all understand this, right? So we have work to do within our own communities, and then go from there. So how are you going to impact the community at large if we as a community aren't all on the same page? So, like I said, I think we have work to do within our own group, to really make sure that we have a level of understanding that's satisfied before we go into a bigger, group. So when I say that we have to do the work, we as individuals have to do the work ourselves, before we can then go on and, work in bigger groups, and it can happen at the same time. I'm not saying you have to become an expert. That's not what I mean. But where you see yourself, like what you said before, like, I don't know what B is. Okay, that's fine. Then, now you know what I mean? So you did the
Ask the
work, so
question.
figuring out, that's right. You asked the question, you figured out what it was, right? So, and I do the same thing because there are plenty of things that I don't fully understand. And I have to go back and say, hey, let me figure this out. Let me go back and read up about this. And education is lifelong. We committed to lifelong learning as nurses, right?
Yeah.
And so this I think is part of it. And I just think making sure, like Jean said, people understand the connection, because right now there is a level of, people are unaware of the connection between those two things. They don't understand how one impacts the other. And we have to get this right, because if we want a healthy community and a strong community, we have to figure these things out. We have to figure them out, and we have to help people get to the places that they need to be to make our community an environment that we all want to be in and live in.
I mean, I'd like to propose the NACCHO, which I do. I think they're a great resource, period. They have so much there that I can look into that and send the information in regards to how we can all sign up for that, so that we as a board could possibly look into it. So we all have the same base that we're talking from too. I mean, obviously we have different bases, but at least for the base. And that would, in my opinion, does anyone else think differently? That would be the next logical best step.
And I mean,
I think it's a good starting point.
Even if we wanted to, sorry, Jean.
That's okay. I said, I think that's a good starting point for us as a group.
I agree. And I mean, even if we wanted to invite the Community Alliance along.
Is that something that's it's like a seminar type thing, like in person, or do you do it online?
You do it online and you do it at your own pace. And it's a series of courses, that you can take collectively as a group, and you can have as many people. You just can't do it one person at a time. If you're one person, you got to jump in with another group. So if we formed a group, we could definitely do it together as a group. But I say, opening it up would be wonderful.
So, and I know we're at 7:34 now. I would like to say, are we comfortable with me researching it, sending the information out? And should we meet before our next scheduled meeting? Or you think, being the summer, I think everyone's.
Yeah, I think we can meet beforehand. And I think we need to reach out to the Community Alliance. I think they're meeting next week or something. They have a meeting coming up, but maybe we can get on their agenda for a future meeting, just to kind of learn from them what would be helpful, from their vantage point to have from us, and vice versa. We need to have a conversation with them. Like, what are your thoughts? What are your plans and ideas that you have for bringing the work forward, that they proposed? And so I just think starting a conversation would be good. But in the meantime, a little homework of our own would be helpful.
All right, I'll go on Nacho and gather I keep calling it Nacho, I'm sorry, NACHO, and gather the information and how, we can get signed up. And if there's a cost, I don't know that there is.
It's not.
I didn't think so. Nothing seems to have any cost to them, and how we can best do that. And I agree. I think doing it with them would be great as well, because we're medical, so some of the things might make sense to us, but it's a good, start for even. So I'll do that. And then are you comfortable reaching out to them, Kathy? Do you have
I can do that. And if you'd like help going through the website or something, we can arrange another conversation later, I don't know.
And then we can either schedule a special meeting. We can call a special meeting if we wanted to put something in action before the second Tuesday in August. But being the summer,
what day is that?
You know what? I thought I had that here, and I do not.
I can look really quick. It's the 10th. That's fine. It's August 10th.
All right. And but I'm absolutely happy to be a part of a conversation with them before then if they'd like to
Yeah.
have a.
Yeah, just to see if we can work together with them.
Does
Just
anyone
for
else
an-
have any suggestions or?
Well, I just wanted to say, just for an FYI, if you were gonna do another meeting beforehand, I'll be away the first week of August.
I am.
As will I.
Okay, so then
That's
there we
out.
go. And then Kathy,
Dr. Muhammad, are you stuck here? You're the only one that's here.
When does Maureen come back? The end of July? She got a very well-deserved break.
She is gonna come back, I think, earlier August.
Oh, okay.
Yeah.
So maybe it would be better off just keeping.
I'm not going anywhere, but so far, there might be, the travelings are opened up, so I may have to travel for work or conference. We don't know. Everything is up in the air. Now we're just trying to see, and who knows what is out there, how we, month by, I just don't like to project very long from where I am right now. That's what I said, I will revise all the policies and things of that on a monthly basis to see where we at. So yeah, I don't have any plans to go anywhere. I'm stuck. You're right, Kathy.
So unless anything changes, then maybe we just keep the next upcoming meeting because it sounds like Maureen's not going to be here or so, but we can do some background work and research and get the information for the programming. And you sent the link, and I actually meant to go on it this weekend, and the weekend got away from me. So
did she send you the PowerPoint of what she shared today? And if not, Kathy, can you?
Oh yeah, that would be great, Kathy.
Sure.
It was a great presentation. Thank you
You're
so
welcome.
much.
No problem. No problem.
We all learned from your presentation, Kathy, and that's a good thing.
Well, good. I'm glad to hear it. And I'm happy to do more if we need to. Like I can, if it's helpful to everybody and
if you don't
watching.
mind, like I don't want to reinvent the wheel. When you have time, you can share your slides so I can use it. If there's any other residence training or medical student, I think you already did the heavy lifting. So
Sure.
I would appreciate if at some point. I mean, those infographics are very helpful.
Great. Sounds good. I will.
Thank you.
Yeah, I have to say that one infographic tells such a story just standing alone, and you look at it, and I had never seen that before, and that was great. That was great.
Good.
Yeah, I'm definitely using that myself, actually.
Good. Feel free to share it.
Thank you.
You're welcome.
All right. Does anyone else have anything that they want to discuss or cover tonight? I know we went a few minutes over.
Just quickly, if you recall, Heather, you and I had chatted about community engagement and some other projects that we talked about, some screening and all that. When Maureen comes back, I think we should circle it back, and hopefully COVID is not going to take most of our time, and we can talk about other, there are other chronic diseases that still make our population unhealthy and all that. So keep that thought sort of active, and we can present it to Board of Health at some point, what we try to propose and get others feedback and input. Those are very valid. And I think Maureen was very interested as well. And I offered, I'm more than happy to lead it along with one of the Board of Health members, sort of more of a voluntary along with healthcare folks who have some idea on how to approach things, eliminate the disparities in healthcare, some of the access to healthcare, education, and all the good things that we know are quite effective measures to help the community. So, yeah, something that I know you were discussing about it. So I think, and that will tackle some of the inequities, Kathy. Those are very important points. Like you said, access to care is challenging despite having the health insurance.
Yeah. And I mean, Dr. Muhammad, whatever you propose, those disease states that you're trying to, I think we need to do it all. You know what I mean? There's not, I'm not proposing that we only focus in on DE
No,
and
you're
I
right.
and that's it. I'm saying that because honestly, everything that we do would incorporate DE and I into it anyway.
Yeah,
So it's really kind of like the lining that goes through everything. So the work that you're proposing still should go forward, but maybe with that lens added to it.
Yeah, and you're right. You know, this is exactly what Heather and I were discussing. We're just exploring some of the ideas. I understand that even the Board of Health has just launched their, as you said, within the during the pandemic, you launched, and you all are very professional enough to kind of look at your own community. You know your community better than anybody else. So what are the missing links? What are the areas where we can all get together and start tackling issue by issue? I know there's some, but there will be some budgetary constraint and all that. But I think the mayor as well as other leaderships were looking into it. We never had a chance to meet with the mayor at some point. I think at some point we would like to present our ideas to the leadership. You know what I mean? So I think that would be helpful to support Maureen and just some of the services that we want to propose for the community well-being, and that will help us put as you said, put those into our priority for the city, for the health department, so we can tackle. So when I look at my public health hat and go through the lenses, I see, maybe we can start small and we can expand all that. We have to start somewhere. My experience has been, if we ask too much, we're not, then it becomes an issue. So let's make it sort of a milestones related public health intervention, if that makes any sense.
It does.
Yep.
It makes sense.
Yeah. In all your points, like all your ideas and points and focus will be very helpful, but we have to start somewhere. And I think this is what I propose, as a part of Board of Health member, and also, working hand in hand with the community. I think, us serving the mobile clinic and reaching out to the targeted population was very, very effective. I mean, think about it. I mean, so keep that hat, non-COVID issues are still prevalent. And then we should reconvene and explore all these options. I mean, having a dialogue and discussion, right, Heather, would be helpful.
I'd like, this is just me speaking, what I love to see is what Kathy did today as one of the Board of Health members, and bringing forth something that, she is knowledgeable about and that she understands and we know needs to be tackled, and educating the rest of us. I would like to see all of us take, something that, as you're saying, whether it's by statistics, an issue, a health issue, which is the most pressing, hypertension, or
I mean, we can do both. I think that's what that's what Dr. Muhammad is saying. I feel like we have to do both, because you're right. I mean, these problems they're tremendous problems in our communities, right? And so you have to address hypertension, diabetes, heart failure, the major problems that people are suffering from.
Right.
But for them to get the health care that they need, you got to overcome all those other barriers to get them the help that they need, the care that they need. So I think that we as a Board of Health can make recommendations to help people overcome those barriers, to get them to people like Dr. Muhammad and the clinicians that he has surrounding him, so they can help them.
So think of that as sort of, if you don't bring it up, nobody else will. Right? Board of Health is statutory mandated in any type of town or city and what have you, right? So you have that basically value in any given government, local government. So you bring it to the attention. Maureen is a staff member. She would look at her resources and will say, look, in order to accomplish these top 3 goals for year 2021, 2022, we need to expand on this area, or we need to focus or hire, or what, and that gets appropriated or allocated to accomplish that goal, because we will focus on the targeted measures. We're not going to just hypothetically say, no, we know the needs of our community, right? We know that where the actions can make an impact. So that sort of, and I think that's, a lot of other folks are becoming creative. We can survey our community, so you can use your churches and other centers, religious, where we can have a pool of or sample of those responses, a direct participatory community outcome research. And that's the key when we talk about eliminating the disparities, or reducing the gap, and combating racism, right? So that exists in every shape or form of life. However, as a health department, we would say that, why do we have systemic racism in healthcare delivery system? So I'm again, call me, visual person. I'm more of like dreamer, and I think about if you have to be in the middle of something, what would you tackle? Obviously, pandemic kind of derailed all of us. So if it was not a year of pandemic, almost 14, 15, 16 months, we would have been already moving forward with that. However, it's never too late. I think it says in the verses, with every calamity there's blessing, and I think we have to look into that part. So it has illuminated, as you said, Kathy, some of the distinct areas where human beings are somehow being compromised, whether it's so I'm all with you guys as a member of Board of Health, and I think I will advocate to the best to look into these areas, and we kind of go from there as a team.
Sounds great.
And I'd love to invite anyone. I know I send my emails with whatever, and if you something you're passionate about and would like to present to us, please. I'd love to see it and
we'll do.
Present it.
We'll do.
I also think being more present, I liked, if I knew that you guys were going to be at the Juneteenth, I would have come. I think being more present in the community is something that we can do at the festivals, at the, you know what I mean? And that's a way to educate people on whatever it is that we're focusing on educating people about.
Yeah, that's really important. I think that visibility is really critical.
Getting out in the community, absolutely.
Having conversations, talking to people.
Yeah.
And I do know, just going back to what you had said, Dr. Mohammed, the Sustainability Committee was also at the Juneteenth and did do a community survey. It's not really health focused, but it may be that we can use some of the information that came in from even that about concerns in the community and that sort of thing.
Right.
We also have the community needs assessment that was done by the hospital, which has some really rich information in it. So that's
all these data points, and yes, all these data points, we have interns that come through West Haven Health Department. Currently, Maureen has some good interns, bilingual and all that. So these data points can give us a little bit of what's the prevalence of issues, where we can make, targeted intervention and focus. And that's what we need to present to the leadership, that this is how we proceed, the status quo.
Kristen just reminded me, the Savin Rock Festival, it might be possible for us to have a booth or a table at the Savin Rock Festival.
Oh.
I think, I could be wrong, but I think it's actually that first week of August, but I would have to go back and look at the dates. But if so, if Dr. Mohammed, you're around, or if there's other, kind of stinks that 3 of us are already out that week, but I'll double check.
If I'm here, I'm available. If I'm here, I'll do it.
Same thing. If I'm around in town.
Okay, I'm here one of the days. Kristen said it's July 30th and 31st. I'm just not here the 31st.
No, I won't be here. I'll be in California.
I'll be here the 30th, but not the 31st.
We're leaving the 29th, so I definitely won't be here.
Mm-hmm.
Sorry, Dr. Mohammed, you'll be holding down the fort.
I may be able to help a little, and we're leaving in the morning of the 31st, but that's some other stuff. Maybe we can talk in the meantime after this meeting about setting something up there, because I think that is something that's coming up soon, and maybe we can consider.
Also to the Apple Festivals in September, so that might be something to plan for.
I can reach out to them and see if we can get a table there. I think.
Right. In the meantime, let's look at the all the surveys, Kathy, as you were discussing, and other and have intern take a look at it. So, obviously under one of our supervision, just to get an idea. I mean, I think it's worth looking into it. All that information is going to be very, very helpful in planning our activities.
Yeah. Okay. Sounds good.
Awesome. All right.
Thank you so much.
Thank you. And so can we have a motion to adjourn?
I make a motion to adjourn at 7:52.
I second.
Second.
Thank you, everyone. It was a great night. And thank you again, Kathy, for your presentation.
Yeah.
Anytime.
Stay safe, everybody.
Thanks, you too.
Bye.
Good night.
Bye.